Good morning or afternoon, everyone. My name is Christine and I'm 62 years old. I've been under the observation of Einar at the National University Hospital in Iceland. I was diagnosed with drug-induced liver injury in December 2020. That's more than 1.5 years ago, and I've not fully recovered yet. Early on, I expected recovery within weeks, but now I think I will perhaps not get well enough to start my job again. Well, today I'm, of course, much better than I was, and my last blood test also confirms that. In May, most of my liver enzymes are normal, except gamma-glutamyl transferase, which I'm told is of least concern. My lipase levels have been rising very slightly lately, and I'm due for a checkup in August because I have benign polyps in my pancreas. Sorry if I'm not pronouncing these medical terms correctly. So, looking back a few years to what triggered this. In 2017, I developed pain in my thighs and shoulders, and then I also started having problems with my sinuses, and from that also asthma. So in September 2020, I had a sinus operation and was diagnosed after that with chronic rhinosinusitis with eosinophilic nasal polyps. The operation went well, but a few weeks later, I got an infection, which escalated and my asthma turned into bronchitis and then pneumonia. So for 4 weeks I was prescribed augmentin and then was to continue with azithromycin after that, and had only taken 4 pills when I became sick. My sinuses were still in a bad condition at this time. So my liver symptoms began in the beginning of December 2020. And this was with an overall feeling of being sick, with a stomach ache and nausea. So I went to the emergency room in my town, and this was in the weekend. And I had a blood test which confirmed slightly increased liver enzymes. I was feeling pain all over my abdomen and actually thought I had a bladder infection, but that was not the case. So I stopped all medication in the beginning of December at this time. They told me to wait and see. And I didn't get better, just more nauseous and more tired. And then my urine got dark and my stools almost white. Before that, I had also had a rash, red swollen rash all over the upper part of my body and my back, almost to my neck. And this rash lasted for a few days. On my second visit to the emergency room unit, I was prescribed ondansetron bluefish for the nausea and Phenergan to help the itching. They didn't do much good, I think. I didn't use a lot of them. I'm afraid of medications. Okay, so the worst symptoms during the period were nausea and itching. However, the stomach ache went away. So I was not actually in pain after the first 2 weeks. The itching was extremely bad. I couldn't put on clothes, couldn't sit, bathing was difficult, and being touched was painful. Also lying in bed, almost like the outer layer of the skin was becoming loose or something. And these symptoms were most severe in the middle of December, when my skin had become yellow, and until the end of January, when they gradually began to lessen. And I remember that later Einar, my doctor, which I met just before Christmas, by then I was under observation in Landspítalinn, the National University Hospital, and he recommended going to the swimming pool for the itching. And I just thought this was hilarious. Just taking a bath was painful, and I was actually too tired to do anything. So don't tell your patients to go to the swimming pool if they have itching. I just walked around the house in circles, just like a mad woman. But the funny thing was that I was mentally okay, I think, meaning I was not anxious or depressed. Like I was too busy being sick, and there was no space for worrying or anything like that. But actually, I was mostly concerned about my family. I did not want them to worry about me, but they of course saw how yellow I was becoming, more yellow by the day. So I just tried my best to sound optimistic and try to hide how sick I was and tired all the time. I also had this heightened sense of smell and taste, which was very, very bothersome. Everything smelled badly, and this sort of added to the nausea. And my sense of taste was all wrong. Everything was either much too sweet or much too salty. So everything I ate was a mistake, I thought. And it was almost possible just to swallow. And this continued to be very bad for about a month, but then gradually got better. So in the beginning of February, the situation was getting better, much better, with slight nausea during parts of the day and itching mostly noticeable in the afternoon. But I continued to be very tired all the time. I'd been prescribed, talking about medications, I'd been prescribed Quantal before Christmas. Quantal. I think that made a difference, but I'm not sure. I didn't use much of the ondansetron or the Phenergan that I mentioned. And after quitting Quantal in the beginning of February, the nausea and itching got better. By then, my bilirubin levels were also much lower. Then again, I know that my liver enzymes got higher again in February, but the bilirubin did not. And I don't know why this was. You have to ask Einar about that, my doctor. So what I ate these months was mostly potatoes and boiled fish, mostly hot dog and yogurt, lots of yogurt. I was so sick during this time that I did little, and in the end of February I took the dishes out of the dishwasher for the first time since before my pneumonia. This was a great success. Funny how these little things make a huge difference. So I was definitely getting better. When all this started, I weighed about 66 kilos and was very happy with that. But early on, my weight started to drop, as could be expected. And today, 1.5 years later, my appetite has not come back fully. And now I weigh 55 kilos, 2 kilos which have probably gone this year. And I hope I've reached the bottom. And I'm told I'm too thin. And I actually think I'm too thin. But I eat chocolate and ice cream when I want. I still get short bouts of nausea, but only for short periods at a time. I am still very tired almost all of the time. But I also like keeping busy. I sleep a lot, and I realize that my condition is probably complicated. I expect that the liver injury has not helped my overall well-being. So what part it plays in my condition today is difficult to say, probably impossible. So I still have my chronic sinusitis, which is not going away, and I use asthma medication for that. And I also had another operation on my sinuses in December, as I've probably mentioned. And these operations are nothing to look forward to, very unpleasant to say the least. And since before the operation, I've been using steroids. I had some antibiotics then for some period of time. Don't remember what that was. Yes, I've been using prednisolone. Well, actually most of the time since November to keep my symptoms under control. I also have some issues, as I mentioned in the beginning, which are perhaps polymyalgia, I'm told, or something similar. So, as you hear, I'm mostly a mess if you only look at my physical health. But looking at the psychological side, what I've done in the last year is writing childhood memoirs and short stories, and that has helped me a lot. At least my husband is still willing to listen. But going back to work is probably not in the picture. My sleep is often interrupted during the night, so I sometimes stay in bed late, that is until 9 or 10 in the morning. I never take sleep medications or anything like that. I've never been much of a drinker. I almost never drink, so my liver was and is not affected by alcohol. Yeah, I've probably had 2 beers, 1 glass of white wine and 1 of red, during the last year or so. I think it's very important for people, especially doctors and pharmacists, to be apprehensive of symptoms of DILI. In my opinion, well, they're not. And people, they're amazed, they're surprised when I tell them what happened to me. And the young doctors that I saw in the beginning, they did not forward me to the hospital. I only came there because of a pancreas scan which was due. That scan was postponed because of my obvious jaundice. This was in the middle of December 2020, and I met Einar, my specialist, a few days later, just before Christmas. Okay, well, I've always been skeptical of all medication, antibiotics included, sleeping medications and all these non-medical supplements, which I just don't believe in. Okay, I think television is the best way to get to people, to inform people. Like everyone likes watching films, almost everyone. So I think documentaries is a good way to reach people. Like get people like Michael Mosley interested. He's made a lot of health documentaries. Shouldn't be too difficult. Also, if known personalities and celebrities get DILI, everyone would be interested in their stories. Well, I'm not wishing this to anyone. Sorry about that. I actually think I'm very sensitive to side effects of medications. So I should perhaps not have been surprised getting liver injury. I, for example, don't tolerate alcohol well. I think it takes a long time to get out of my system. And that's perhaps the reason I've not used it. So perhaps there's something in my genes or my body that makes me susceptible to liver injury from augmentin or antibiotics. Okay, today I'm trying to get to terms with the idea of being without a job and getting old. Getting old. I have no problems getting a job. I've had offers which I've had to decline, and my school still wants me back teaching or in administration. And it's important for me to be able to say this. I've used up my sick leave and have temporary disability pension now, at least for the time being. So we'll have to see what I can make of my life from here on. But the idea of not working is not good. I feel my worth is less, my self-worth. I feel that my self-image is shrinking. I am shrinking. Okay, well, I hope this has not been too boring for you. Sick people are probably never very uplifting. So I hope that my story will help you in understanding better what your patients are going through. And thank you for listening. I hope you have a successful forum here today and for what's left of it. Thank you again and have a nice day.